to me is most important is you have to keep talking to people. And all of you, and whatever it is you do in public health, you see a lot of people. You need to draw people out.
If you are a student, you live on a block where a homicide has taken place, in the week following that incident, you will test as if you have missed 2 years of school. We know education is itself incredibly protective against future gun violence involvement, so even just thinking about the behavioral health impacts that gun violence has on root causes, I think is really important.
There are infinite numbers of individuals, especially children, whose lives are impacted, interrupted, whether or not they ever get shot. I live in the south end of Hartford. It's a neighborhood with high rates of violence. And when I talk to kids in my neighborhood, and I do that often, they tell me that inside school they feel pretty safe compared to how unsafe they feel walking to and from school. Every single day they fear for their life, walking to and from their school. Their brain chemistry is altered. Their brains are broken by that constant exposure to violence and trauma. They are unable to learn, they are unable to make friends, they are unable to cope. That is one of the reasons why we talk about this as a public health epidemic.
It's been inspirational to see over the last 4 or 5 years how this movement has grown and the number of health systems that have really joined this cause.
When you're on an effort like this, and the journey is long, and the goal seems far off, it is very important to recognize that along the way we're making some positive change.